in society, and they are then placed in a dangerous situation, and we've seen the issues with grooming gangs and things like that, and a lot of people have not really wanted to address those things, but really problematic. I do think that it's slightly ironic that the Observer and the Guardian run this piece after having had 3 years where we've seen real big impositions, and one of those was the vaccine mandate, which was imposed, that the care workers across all parts of social care had to have or leave, and we lost over 40,000 of them. So the lack of staff, over 165,000 in social care and beyond that, partly is contributed to as a consequence of that. Now, it didn't happen for the rest of the NHS because many people challenged it and the government did a U-turn. But again, like with considering the implications of things, we have to think about staffing and resource. But these measures, we've still got over 40,000 people who worked at the front line, who've had a lot of experience, that were just lost as a consequence.
Can't they go back now?
Well, I think partially, firstly, some of them have tried to go back, and in some interviews, because they were lost as a consequence of that, they found problems. We've got a campaign actually says that there should be apology to them, but also reinstate and compensate them. We do know that care workers are not paid particularly good money. There is a discussion about how that could get resolved as well. I think this is part of a discussion about care and the NHS across society. And there are some models. You said, how could it be done differently in Bevan and everything? In Europe, there are some models where you have a fusion of different things, but that's about having a public debate and making sure we're at the heart of that, about what we need and what we think is sensible.
Once again, it's the vulnerable, the young